In accordance with Executive Order AB 361, the Humboldt County Board of Supervisors meetings are being held virtually. You can participate via the Zoom call-in phone number, which is located on your screen and on the front of the agenda. Nikki, you may have a roll call, please.
Absolutely. Good morning. Supervisor Bohn.
Good morning, Humboldt.
Supervisor Bass.
I'm here.
Supervisor Bushnell.
Morning.
Supervisor Wilson.
Present.
And Supervisor Madrone.
Present.
Thank you.
All right. So with that, we'll move on to the flag salutes. Didn't we just do this yesterday? Oh my. All right. Please follow me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Alrighty then. For those of you who might be watching for the first time, I just want to do a little run through of how these meetings operate. When we're on an item you may want to speak on, press *9 to raise your hand. And when it's your turn to talk, we'll let you know, and then press *6 to unmute. You will hear this sound when you have 30 seconds to wrap up. So people will have 3 minutes, and that'll tell you you need to wrap it up within 30 seconds. I do turn. We thank you. At 3 minutes, we thank you and basically mute you and move on to the next person, just because we want to be fair. Make sure everyone has the same amount of time. So at this point, I want to ask our CAO if there's any modifications to the agenda.
Thank you, Chair Bass. There are no modifications to the agenda today.
Is there a motion to approve the consent calendar?
So moved.
How about a second?
Second.
All right, we have a motion and a second to approve the consent calendar. So with that, we'll go to public comment. And we have recognized this number, 5288. Welcome.
Can you hear me clearly, Virginia?
Yes, I recognize that number. Welcome.
You did. Imagine that. Well, I did wish to speak on a few of the consent items. D2, I see we're going to continue to teleconference. It appears in my quick assessment from February 8th to March 8th. And again, I think by then we probably will be able to go back in meetings, and we'll talk about that a little. That's agendized later regarding COVID. Won't speak on that now and be off topic. D5, I think the public should be aware that a contingency fund, which apparently has $1.3 million in it still, is having $40,000 pulled out of it, $10,000 apiece for 4 of the veterans' halls to compensate them from lost revenue that they have because of COVID not being able to rent their facility so they can maintain them. The problem with me, and it's an ongoing problem, and until it changes, you're going to keep hearing this broken record, is there's $0 for the veterans down in Garberville. They don't have a hall to rent. The county basically threw them under the bus. I don't know if and when they're ever going to have a place to rent and to continue their business and their good deeds they did. But this is very aggravating. I think that veteran should also, I would hope Michelle Bushnell would go ahead and make comment and pull $10,000 off to enable those people to continue their veteran functions in some way, maybe to rent a building or to do something else in the meantime till you get them something. But it's just egregious to me that the veterans down in Garberville are being thrown under the bus down there continually. Item D7, you have an interim director from HR. And I watched this person in a couple meetings, and I'm very distressed. Not in the area, does not understand what's going on. The public perception is she was pulled in because she was politically willing to butt heads with the auditor controller. And that's not a reason for somebody to be serving in a position. Your human resources department is in a total mess. It's total chaos. And that's possibly why we're what are we, 25% on the average? I don't know, 30% some departments down on employees. And we're having to give deliverables. So those deliverables are not getting done. We still have some of the worst ACES scores coming out of DHHS, because of their not being able to do what they do to bring those scores up for us. So I'm very distressed to see things being done politically. The prior person I felt was doing a good job, and of course she left for my understanding is potentially health reasons, but also being aggravated by the politics of dealing with this board. So at that time, I guess we have a D8, something about Coltrane on there, and that's always interesting to see this. People who think that that's what's going to happen, and they're going to try and block this, that, and the other. So Humboldt County is not going to facilitate any form of coal, any form of any product related to coal. And of course, that's on consent also. I find these topics interesting. I hope the public also does when I take the time, as other people do, and I appreciate that they do, to read the agendas and to understand some of the things that are on consent going through without comment. Thank you for my opportunity to comment.
Thank you. We will go back, and I do see Supervisor Bushnell had her hand up. No? All right. Anyone else on the board have a comment you'd like to make? All right, hearing none, I guess, Nikki, we're ready for the vote.
Supervisor Bass, Chair Bass, there's another hand up. I didn't know if you wanted to take them.
I did not see a hand. Okay, yes, I did. Sorry, I totally missed that one. Sorry about that. After being here yesterday, my brain must be a little bit slow. I didn't look up. 0116. And if you're interested in talking on the consent calendar, definitely.
Hello, you hear me?
Yes, Ash. Welcome.
Hello, my name is Ash Teeter with the Humboldt Freedom Coalition, HumboldtFC.com. I am speaking on item D2 in the consent calendar, teleconferencing and the continuation of the COVID emergency. I hope members of the board had time to read and view the information I emailed regarding the impact of COVID as seen in annual mortality rates in Humboldt County. It started as a curiosity I had when the annual mortality counts I looked on the DHS site were only listed through 2018. This motivated me to do a records request in which I obtained records for 2019, 2020, and 9 months of 2021. Surprisingly, during 2020, the height of the COVID pandemic, before the vaccines rolled out, there were fewer deaths in Humboldt County than in 2019, 1388 versus 1392. To try and form an approximation of what the partial data of 2021, which was 1,050, might look like, I took an average of the first 9 months and used it to fill in the remaining 3 months, resulting in 1398, which would be slightly higher than 2019. I also looked up the annual mortality back to 2006 in the CHHS site and made a graph of all the data. If you look at it, it's a pretty steady number. It averages around 1288.9 over the past 15 years. And on more than a few occasions, it got up into the low to mid 1300 range. Since there's no real proof of significant excess deaths in the county, it must be that through faulty testing and monetary motivation, hospitals tied positive testing deaths to COVID, and in doing so, reshuffled our typical annual deaths to statistically look like an emergency. This is not only a local problem. Recently, 2 senior officials from the Biden administration admitted to be working on recalculating the COVID-19 hospitalizations in the U.S., stating that they would need a panel of experts to review the cases and adjudicate if a hospitalization were for a person who came in for COVID or with COVID. Deaths were lower in Humboldt County during the peak of the pandemic than the year prior, looking to be higher following 2021, where 60% of the county got the COVID shots. This is only ever an emergency on paper, and is due to playing around with the healthcare figures, sparking unnecessary fear and division, and also totalitarian mandates, which choked out the livelihood of our community. Everyone will look better by ending all the COVID mandates now, instead of waiting until it is politically popular in a couple weeks or a couple months. Thank you for your time.
All right, and thank you, Ash. Nikki, I saw a second hand.
Yeah, there it is. I accidentally lowered their hand when I was renaming. So it's 1041 was the next one.
I knew I wasn't fooling. So 1041, please press *6 to unmute and you'll have your 3 minutes. Mm. 1041, please press *6 to unmute. Welcome.
Can you hear me now?
Yes, welcome.
Can you hear me now?
Yes.
And just to make sure I'm following along correctly, we are commenting on the consent calendar.
Yes.
Yeah. Okay. So the teleconferencing, we were promised that, come this year that we would have in-person meetings with teleconferencing. It's not happening. It's all based on this false premise that there's some kind of emergency happening when everybody on this call and everybody in the world knows that there's not an emergency. United Kingdom just lifted their mask mandates and all of their other COVID-related stuff because it's complete hogwash. It's failed policy, and everybody knows it. That everybody's just trying to pivot away from it right now without getting egg on their face. And at this point in time, it's just good for leaders to step up and just go, look, this has been wrong. This has been a mistake. All the evidence shows it's been a mistake. Everything that's been, called a conspiracy theory from day one has literally turned out to be factual. And it's really sad, but we have to pivot away from this and do the right thing. And so that's where we are today. We're here on another Zoom call, pretending like there's an emergency when there's not. Like everybody under 59 years old on HumboldtGov.org, it shows that they have less than a 1% chance of death. And then of that same age group, less than 4% chance of hospitalization. So everybody under the age of 59 has a 99% survival rate and a 95% chance of not even going to the hospital. Please point to the emergency. Please point to the emergency. Please point to me as a father why my children have to wear masks in school right now when they are a completely unvulnerable population. And we're sitting here doing this teleconferencing and acting like there's some emergency, but it's all because the boss is just sitting, you guys are just sitting on your hands acting like there's some other kind of authority figure in the county that isn't basically setting the precedent for all these schools to follow. I mean, the principal of Trinidad Elementary made it real clear to me that they're following the county. As soon as the county makes a difference, then they're going to make a difference. But until then, they're going to sit on their hands just like you guys are. And as soon as the state, so you're waiting for the state to lift this mandate, or are you going to make it like the state too, to where vaccination is the way that you can not wear a mask? No one's going to follow that ridiculous rule. We all know that the vaccines didn't work. The Omicron peak, it was an equal case rate among unvaccinated and vaccinated people, and only one person died. Please point to the emergency. Please point to the emergency. I would love to hear from the boss why exactly we're doing teleconferencing when there's no emergency. That's it. Thank you.
Thank you, Donnie. Okay, we have another hand up, which is 2223. If that's you, press *6 to unmute.
Good morning. Can you hear me?
Yes, welcome.
Good morning. This is Craig Johnson from Southern Humboldt. And I'm hoping that we can move towards in-person with a hybrid model of the teleconferencing, I guess you would call it. And as far as, a brief touch on the mandates, if we look at our leadership of our state, Gavin Newsom, he was at the ball game last Sunday. I think it was 70,000 people, had his mask off for selfies. So I guess if we all have a cell phone in our hand, we should be covered as far as following his mandate. And we look forward to February 15th and the lifting of mask mandates for all and the freedoms that we know and love. As I've traveled around California, going to Redding, other parts of the county even, it's as if it doesn't exist. And I just hope we can follow Gavin Newsom's lead as he did last weekend. So thank you for the comment. I appreciate the time. Bye.
All right, thank you, Craig. I see Karen. Hold on, let me go to the public first and just is there anyone else in the public? I don't see any hands in the public queue. Do you, Nikki?
Somebody just raised their hand, 5457.
Okay. And I do want to find out, Auditor Paz Dominguez, did you wish to make public comment under the 3-minute public comment periods? I just wanted to check. I saw your hand up, so.
Thank you, Chair Bass. I would like to speak about an item on consent if it's still an opportunity to do so.
Yes, that's fine. Okay, and actually
3 minutes or more.
Actually, let me come back since you are part of the county. Because it's not general public comment. I'll come back to you, Auditor Paz Dominguez. Just since you are a part of the staff, I do think you may, I don't know, let you speak it from that perspective. It's a little confusing there. So I'm going to go to 5457. And if you're 5457, press *6 to unmute.
Hi, my name is Lori Birdsong from Arcata, California. and I appreciate this opportunity to speak. I do find this way of meeting terribly difficult, not user-friendly, and seeing the climate of the time, we are no longer in emergency status in this county, and I'm discouraged by the continuation of these mandates on our children, keeping our children masked when there's a buttload of evidence showing that masks don't prevent a spread of the virus, and children are not susceptible and they're not super spreaders, and it's doing great harm to our children. And I just implore this board to really stand up and take a stance for the truth, to move us forward in a direction that is vital and uplifting and healthful for the people of this county, for our children. Just asking that in great earnest. Thank you.
All right. Thank you very much. All right, we are going back to the board. And we'll go to Auditor Paz Dominguez for her comment on the consent calendar item.
Thank you very much, Chair Bass. I apologize, I don't have a webcam connected to my tablet today. I wanted to bring something up to the board about the telework policy for county employees. There is an area where it might contradict with the existing expense reimbursement policy that the board has adopted, which states that no employees will be expected to pay for anything out of their own pocket in the regular course of county business. And this current policy draft says that employees will not be entitled to any reimbursement of expenses should they choose to work remotely. And I'm wondering if the board would consider adding some language in here that in cases where an employee is asked by the county to work from home because either the internet is out at the office or because something has happened at the office that requires everyone to evacuate, that there be an allowance for department heads to reimburse these employees who are being asked to continue working from home. This can be a big impact for a small department like the Office of the Auditor Controller, where we can't really afford to have people not working, who may have, in any department really, who may have tested positive for COVID, but maybe are asymptomatic and can continue working. We can't have them back in the office exposing everybody, so we would be asking them to continue working from home. And I would like to request that the board consider that in those instances where employees are being asked to work from home, that they be reimbursed for expenses like internet and electricity. And in some cases, in the Office of the Auditor Controller, where internet has gone out, employees have had to hotspot using their personal cell phones, which can then increase the data and result in additional charges to them personally. So it's my request that you, as a board, take that into consideration and maybe allow for some expenses to be reimbursed for employees. Thank you.
Great, thank you. And I know a hand went up in the public, but we had already gone back to the board and to the auditor. So the public comment portion on the consent calendar is passed. I did want to ask our CAO, Alicia, so this comment that was brought up by the auditor, I mean, because we are talking about consent calendar and it's really not the place. There were some ideas provided. Is that something that can be perhaps brought back? I mean, do we have to hash it out today, or is this something that we can actually work on? I'm just trying to figure out whether we're going to take this off the consent calendar and talk about it today, or oops, time's up, or if this is something we can revisit since it is a change. But I did see Sean come on. Is he the one that has the information there?
Hi, good morning, Chair Bass, members of the board. I was just looking at the expense of reimbursement policy, and there is a section in the statement of the policy that says that the county shall not conduct business at the expense of authorized personnel within the confines of the policy. So the expense and reimbursement policy does lay out specific areas where the county will reimburse employees and pay for employee expenses, but all of that detail is laid out within the policy itself, if that makes sense.
Okay, so that in essence would be where they would be looking to be guided by that policy, basically.
That's correct. The expense and reimbursement policy is a self-contained policy.
Okay. All right. CAO Hayes and then Supervisor Bohn.
Yes. In addition, the telework policy is framed in the context of the work being conducted at home voluntarily. So there should ideally be minimal situations where the employee is sort of being forced to work from home. And in those cases, we can evaluate offering secure, appropriate locations within the county office spaces to accommodate those employees if there are expenses associated to their work situation that are unreasonable to them. But we have done extensive outreach to the unions regarding reimbursing employees for their telework expenses, and have come to the agreement that at this point in time, the county is not going to be exploring that because that opens up a whole floodgate of challenges with telework that may make telework difficult to administer and offer to our employees if we were to go down that path.
All right, thank you. Supervisor Bohn?
I thank you to the CAO for that, because I know that when we did this, we had meetings and there was, we don't make a move without talking to the union, and they were looking out for their employees, and we came up to what we thought was an amicable agreement. So I think it's perfectly in line, and that's what I was going to ask. I thought we already had an agreement made. So, and then if we go farther on that, maybe we could, if something does come, or if you can maybe we could look at a per diem type thing where we pay whatever, because I'm not going to pay for the hookup. I'm not going to pay for the whole month of internet. I'm not, I don't think the county wants to pay for that when they're going to work at home for 3 days for, whatever. So I think we will be, if the union presents us something different, I'm sure that our CAO has always been more than open door policy with all our bargaining groups to make sure that they are getting the best treatment from us. So thank you.
I don't want to get into conversation on this. I'll go back to the auditor one more time, and then either that, because if we're going to talk about in depth, we should take it off. But I would just like the auditor's hand is up, and I'll go to Supervisor Bushnell.
Thank you very much, Chair Bass. I do want to say thank you very much for your consideration of my comments, and to the CAO and Deputy CAO. And I only have one point of clarification to add. It's a question. You can choose to answer it now or later. There's an area in the policy that says the county may ask employees for pictures of their workstations at home. My only question is, would the pictures of employees' homes be then public record? Just a question. Thank you.
All right. I'll go to our CAO for that one. Oh, I'll go to the county council. Even better.
Chair, we would not release those pictures to the public.
Okay, thank you. All right, and Supervisor Bushnell, your hand was up, now it's down. Supervisor Wilson, is on this one or another item?
No, it's I guess thank you for everybody for helping to supply or help out the vets halls in a time when they're in need with relationship to their revenues related to COVID. I think it's they're just ineligible for funds from just about every other location just because they're so specific. And it's really just to upkeep those structures. On this issue that we're just talking about right just now, I'm just going to say that we negotiate through the union, and this isn't the venue to do that. And I think we're not hearing from the union in this moment, then I think we're okay to move forward. And if there are issues and problems, we'll hear about it through that, and we'll address them. Thanks.
All right. So we do have a motion And there's been a second public comment and conversation at the board level. So I don't see any other hands up. Nikki, can we please have a roll call vote?
Absolutely. Supervisor Madrone.
Yes.
Supervisor Wilson.
Yes.
Supervisor Bushnell.
Yes.
Supervisor Bass.
Yes.
And Supervisor Bohn.
Yes.
Thank you. Motion carries 5-0.
All righty. Thank you. And at this point, we'll go on to our special presentation. And this one comes to us from both Supervisors Bohn and Bushnell. And it's a recognition of Lon Winburn, and very well deserved. I'll turn it over to you guys.
Thank you through the chair. Welcome, Lon. I'm probably going to have Supervisor Bohn do most of this as I'm 1 year in and have only worked with Lon for a year. I wanted to say that over this last year, I've gotten to know you and the Fortuna Fire Department, and really have came to realize the connections that you specifically have with all the other departments in Humboldt County, and just was really honored to be able to learn about the Fortuna Fire Department through you this last year and the importance to the Eel River Valley. And I want to say congratulations on your retirement, and glad to see you're still at the fire department there. And I don't think we have sound, Lon. I don't think I can hear you.
I should be.
Oh, there you go. Yeah.
I believe I'm here. Yeah.
You're here.
Yes.
So anyways, 31 years, did you say? Is that how long you're?
33.
33?
37, but I guess we can look at yeah. It's been a while.
Well, what an accomplishment. And, being a volunteer fire person, although you were the chief, that's how it started out for you, and what a commitment to the community and to the people of Humboldt County. And I just want to applaud you and thank you and say congratulations. And I'm going to pass it to Rex.
Thank you, Michelle.
Well, and I'm going to repeat stories I always tell, but Lon's been a friend since the mid 60s, so he should retire. He's old, like me.
You and me both.
But him and his wife, Julie, have made an impact they are definitely a team, but the impact in Fortuna and to the fire service down there. And she's not retiring because she's still on the ladies auxiliary, but Lon's still going to be around. But we have a new chief stepping in, Russ Brown, and he started within a very short time, 30 some odd years ago, with Lon. And so it's a kind of a seamless transition. They've done a great job with their Explorer program, which is now considered Junior Firefighters, I think they changed the name. But the respect Lon gets throughout, I was a volunteer 40 years ago, and I remember Lon when he started because we were friends, and we've always crossed paths both in business and everything else. And if you went to any of his retirement parties, he had a longer going away party than Derek Jeter did when he did his tour. But the respect that was shown by so many people, it was pretty impressive. And people from his old work showed up. It was very nice, and it was well deserved because he championed a tax that made Fortuna stand on its own. He recognized problem buildings because he was the inspector. I mean, the Greens fire was devastating, but it was not unexpected because Lon knew there were issues with that building, and that helped him fight it because he knew that there were areas where that fire could travel through cavities and through the building and stuff, and that saved not as much property, but it did save lives when they fought that fire about going in and going out. So I just think when you lose somebody like this, we're not losing him, but he's getting a chance to step back, enjoy his wife's business, which he helps run, and basically look back on his career and realize, and no better words can be said than, damn, he did a good job. And that's what I heard more than anybody else. And he transitioned a big department with a full complement of volunteers, which every other department, that's their biggest screaming point. We need volunteers, and those people are proud down there in Fortuna because Lon instills that in them. And I think he's done a great job. I think I'm more proud I get to call him my friend all the time. So that's a big deal. And so Lon, you and Julie, congratulations. I know Supervisor Bushnell has jumped in this last year and enveloped the department. And we appreciate everything you do because you don't stay inside the city limits. I mean, you've got a station out there in Hydesville that you man. You've got stations all over that you man that goes outside the city limits. And I think the appreciation by all the other departments, the show of captains that showed up or chiefs that showed up at your retirements. So usually we have this big long proclamation that tells everything you did, and we've just got a short one, so I'm able to ramble a little bit. But I think that the majority of your career was as a volunteer. And volunteer when you started was a 2-hour meeting once a month. And now what's the average volunteer? What's in a year? How many hours of training does he have to do now, Lon?
Well, an individual probably does 100 plus easy. I mean, I think we log well over 3,000 hours of volunteer time here at our department.
That's 2.5 weeks of work to be a volunteer.
Pretty much, yeah. Yeah.
And I mean, you're not volunteering to get to go watch a baseball game or coach a baseball game. You're volunteering to run into a burning building and save people. So that makes an extra special. So Lon, thanks for prompting so many young firefighters, and you've got some young ones that all say you were their mentor, and they're pretty good kids. And I think you left it in good hands. So thanks, buddy.
Well, thank you, Rex. Thank you, Michelle, and the board. I will say it's been a real, I mean, the reward is mine. The whole career it's really been a huge reward to me. Whether it's helping somebody, picking them up off the floor, whether it's being involved in county, fire service politics a little bit, or helping other departments, it's been very rewarding. And I tell you what, coming into the county early on, working with, Board of Soups and, CAO and all that, that's been some great relationship building, and I've appreciated all the support. And I know you'll continue to support the fire service in the county. I have no doubts of that. And I'll be around on a part-time basis, helping out where I can. So thank you very much.
Lon, we've got Supervisors Bushnell, Madrone, and CAO Hayes.
I just wanted to thank you through the chair. I just wanted to follow up with what Rex said. And, through my second district, we have a lot of volunteer departments, and I go often to them, to their fundraisers, and we're trying to do something in the Garberville area right now with annexation. And I repeatedly hear, well, Fortuna did it this way, and Lon helped us this way. My son, who is now on the fire department in Alder Point, came last night and did a CPR class in Fortuna. So the amounts of collaboration that I hear throughout my district with Fortuna Fire, it makes me proud. And Lon, I hear your name all the time in those arenas, and I hope that you're proud of your department and what you've accomplished there. I know you are. And I know it's not just you, but your men, but you were a leader for them for a long time.
Thank you.
All right, Supervisor Madrone.
Yeah, Lon, also kudos to all your career, and thank you so much for everything you've done. It's been a real pleasure working with you the last couple of years on the Fire Services ad hoc and with the Fire Chiefs Association. And, for folks that don't know, Lon doesn't just support his department. He's a major player in supporting all the departments all over the county through his work on the Fire Services and Fire Chiefs Association. So I just want to thank you for all of that, and it's been a pleasure, and enjoy your retirement. You've earned it. Thank you, Lon.
Thank you.
And CAO Hayes.
Thank you, Chair Bass. Lon, it's been great getting to know you over the past 7 or 8 years. We've worked pretty closely through Measure Z and the Fire Services Subcommittee, and I've really appreciated your calm and reasonable approach to problem solving, and your retirement is going to be a monumental loss to not just Fortuna, but the county in general. We'll miss you greatly, but I am glad to hear that you've been coerced to come back part-time. So you'll still have a toe on the waters, and I look forward to crossing paths with you in the next over the next years. And congratulations, and enjoy this time.
Thanks, Alicia. Appreciate that.
All right, Supervisor Wilson.
Well, this is actually, when I saw this on the agenda, I was like, oh, no. I just want to say that at my time working or being, on the fire service subcommittee with you there, I just have to say, my sphere of knowing you is really through that venue. And I just want to say it's always a pleasure working with someone who's so smart, and I have to say strategic. I just really am very grateful that you're a person that really sees all of the moving parts, both physical and technological and human. And I think that is just really, really an important skill set. And doing it with, I want to say, with just grace, in a way that communicates care for the greater community, and also helping the greater community formulate those responsibilities and through these tax measures and through these other ways to actually help us self-sustain and I think that's just a real caring, and I just really appreciate all the work that you did. So, and I'm hoping that in this part-time role, you might, remain close to or around that fire services subcommittee, because it has a lot of moving parts in it. And I have to say, I'm just grateful for the time that you were there when I was there. So thanks.
Thank you very much.
And before, everyone said everything already, but I think I'll point out, I got to work with you a lot with the Fire Chiefs Association, because I don't think I really knew you before that. And then the last 11 years, I think I've crossed the path multiple times. I used to love the presentations you guys did on like the year in review of all the different calls and the fires. And you always did a great presentation when you were there. I missed being in person. I wish you could have been with us in person today, just for us to say goodbye to you. But it sounds like it's not necessarily goodbye. It sounds like you're still going to be around.
Definitely be around for a little bit. Yeah, I think so. I'm excited to be able to help where I can on a limited basis, obviously, for as long as I can. But yeah, thank you very much. Appreciate all the nice comments.
Well, we do have a hand up in the public, so we'll go and it'll be 5288. And it's your turn. There you go. Welcome.
Ron, this is Kent Sawatsky. It's been a pleasure supporting all of the fire departments here, especially yours. And your business model is reflected by how successful you are. I originally did some numbers, which I do, and of course you were the highest funded until recently, the highest funded fire department around. But that's a reflection of the people who are more than willing to pay more, and they were getting what they paid for. And that's, I think, a pretty good compliment. Your business model of continuing with a volunteer fire department, as mentioned before, developing the younger people and including them is what was historically the fire department that was functional and worked well. And of course, you've continued with that model. So you're on that end of the spectrum, doing just about everything right I could think about as far as fire, which was always a pleasure to support you and the fire departments. And of course, on the opposite end of the spectrum, we have another city and another one that got a bunch of money here, but they haven't done what you did. They don't have a volunteer system. They're not doing that. And so they've switched over to totally paid everybody. And I think that's really hard on the community. So no matter what people say, the fire department has way more of a job than just putting out fires and doing calls. It's being a kind of a binder for a community and keeping them all together with the same kind of a social atmosphere that you have in Fortuna. So I wanted to compliment you on that particular thing. And I can tell you're not going away. That people's no matter even when you do eventually pass on, people will remember and they will hopefully follow through with what you've started here. And I think that's the biggest compliment anybody can give you on anything. So thanks for what you're doing. It's going to be a pleasure to support continuing to make sure Measure Z goes to the fire departments. It's unfortunate Measure S just went away, and there's probably maybe $12 million in that pot that won't be available. But that's just the way county politics happen. So congratulations on your semi-retirement.
Thank you, Ken. Appreciate that.
All right. No other hands up in the public, so we'll go back to the board. Anyone have an additional, Supervisor Bushnell?
No, do we need to make a motion to accept reluctantly the presentation? I don't know if we do or not, but I'm just.
It was a great present. We don't want to pay, but yeah. I guess, sure. You made a motion to accept the presentation.
Yeah.
Is there a second? If we say no, I'm not sure what that means.
Second.
Supervisor Bohn seconded. Got a motion and a second. Maybe have a roll call vote, please.
Absolutely. Supervisor Bohn?
He said yes.
Supervisor Bass?
Yes.
Supervisor Bushnell?
Yes, and congratulations again, Lon.
Supervisor Wilson?
Yeah.
And Supervisor Madrone?
Yes.
Thank you.
Great. Well, thanks.
Have a great day, Lon.
Hey, thank you again. I appreciate it all very much. Thank you.
All right. So now we're going to move on to department reports. The first one comes to us from the clerk of the board, Clerk Hayes, and it's regarding a potential appointment to the California Cannabis Authority. So at this time, Ms. Hayes.
Good morning, Madam Chair, members of the board. The item before you today is for your board to consider making an appointment to the California Cannabis Authority. Our office received notification from Supervisor Madrone of his intention to step away from the appointment to the CCA for the 2022 calendar year. And therefore, the seat is now currently vacant. And the item before you today is for your board to consider replacing that seat with another board member to represent Humboldt County.
All right, thank you. Supervisor Bushnell?
Yes, I just, Kathy, can I just confirm that I'm the alternate on that?
There is no alternate. John Bartholomew, the treasurer tax collector, is actually serving currently with Supervisor Madrone. So
Okay.
There is no designated board member as an alternate on that committee.
Okay, thank you for that. I couldn't remember, and now I do remember that, but thank you.
All right. Any other supervisors have interest in this? I mean, Supervisor Bushnell, that might have been expressing interest. Supervisor.
Oh.
I do have some interest, but with just taking on some new commissions, because at the time when we did assignments, this one wasn't available. Is Supervisor Bohn, are you interested in this one?
Well, and the only reason I've never really put a push, but the only reason is I'm on the executive board and still serving on rural counties, RCRC, and with 38 rural counties and a majority of the, it's on our docket almost every meeting, something to do. And I think if anything ever showed that we need more unity across with the DCC and our counties, so we are delivering across the board, like liquor, like tobacco, across the board taxes, taxes and everything else. It was yesterday. So I would love to take that there. RCRC was the primary author of Prop 64, good, bad, or indifferent, but Arthur Wileen, our counsel, who at the time was with Butte County, was instrumental in writing that. So I have quite a few resources to fall back on. I would do it. I mean, it's not like I don't have enough committees or anything else, but I think after watching yesterday and the importance of getting a focused across the board situation, so everybody is on the same page, and I'll do it if so asked.
All right, thank you.
If elected, I will serve.
All right.
That's somebody's famous quote, isn't it?
Yeah. Well, we can make, is there a motion of any type, or Supervisor Wilson? I mean, tax collector Bartholomew, sorry, your hand's up. Welcome.
Chair Bass, thank you for letting me speak. I just wanted to throw one perspective out there. I've been involved with the CCA since before it was even an established organization. And unless the county is going to engage whereby it will require cultivators to provide their API keys from the metric system so that data can be tracked from Humboldt County and thereby make the platform that CCA offers useful for county operations and understanding of what's happening within the cannabis industry here in Humboldt County. Unless the county is going to do that, I don't know that there's a lot of value in staying active with the CCA because it's costing, I think, $28,000 a year. And again, I hate to say this because I've been a huge supporter of CCA since the beginning, and I got involved in it because there was no banking ability for cannabis, and there still is limited banking ability for cannabis. And I felt, and I still feel, that cannabis can only become a part of the economy through a banking relationships, just like all other businesses have. But in any event, that's why I got involved with CCA way back from the beginning. And I think the county should decide if the cultivators will be required to participate on the CCA platform or not. If not, your board should make a decision for what kind of value the CCA is really providing to the county. Thank you.
Thank you. Supervisor Madrone.
Yeah, thank you, Tax Collector Bartholomew. Yeah, John and I have both been attending these meetings, John a lot longer than I have, and I agree with John completely. I think we ought to bring an item back. It's not really in our wheelhouse this morning to decide whether to leave CCA. We didn't set up the agenda item that way. It's really just to appoint a new rep to replace myself. But it's a good discussion. It's a timely discussion. And frankly, the 7 or 8 counties that are involved in CCA, they do use the API key. They do provide all of their data. And the main reason they're involved, as I understand it, is because they use it as an enforcement tool in terms of trying to use the metric data to figure out if farmers are reporting accurately or not. But frankly, it does nothing for enforcement for uncompliant or unlicensed applicants because that's not the way it's set up. And it costs $28,000 a year for the county to be involved in this, and we get very little value out of that. And it's primarily because we use the eye in the sky for our enforcement, both for licensed as well as unlicensed farmers. And so it provides very little benefit, frankly, and money's getting tight. And so I would very much support bringing back an item at a soon-to-be agendized meeting and consider whether or not we should continue our membership or not. There is another forum. It's called the Central Coast Cannabis Forum. They meet quarterly for 3 hours. The CCA only meets for about an hour once a month, and you don't get much done. The Central Coast Cannabis Forum meets for longer periods once every quarter, and they really accomplish a lot. They share a lot of information with each other, and I can forward the information for that group to whoever is our new representative decided here today. And it doesn't cost us a dime to be part of that other organization. So I agree with what John said and would recommend we bring an item back in the near future to discuss whether or not we should maintain our membership or not. Thank you.
Thank you. Well, we can still put somebody on for now so that we have that piece. And whether it comes back, I don't know if we have to do board ordered. I think it also can come back, a supervisor can bring an item forward as well, I believe. Alicia, where'd you go? I mean, if we didn't, I mean, we don't have to decide right now as a board action, do we? Or Supervisor Madrone can then bring an item of his own in the future to have that discussion.
Correct. Today's agenda item actually didn't allow for that direction to be provided. So yes, staff can return at a later date and reevaluate our contribution and participation in that entity. And Supervisor Madrone and I did discuss this yesterday, and given the reductions to the excise tax revenues, this can also be incorporated into the budget process as well.
Great, thank you. Supervisor Bohn? We can't read your lips.
Read my lips. I also look at this as, was it CCMS, the medical group, the indigent insurance group that we had for so long, that we belonged to, that we'd pay $250,000 a year to belong to, and we had 4 people that were in it after Obamacare passed, and we went to them and says we're not going to pay anymore. I don't know if these 7 counties have all got together and said we're not going to pay anymore because of what this is, or if it could stay functioning without us having the state oversight, whatever state oversight they have. So I don't know. It makes me wonder if we're supposedly the center of the universe for us not being involved in anything that's going on. And because my biggest fear is if you're not at the table, you're on the menu usually. So, and again, I'm not looking for if this is something we shouldn't have belonged to. Would have been nice to know it a couple years ago, but I'll go with the pleasure of the board. I'll sit till we get kicked off or kick ourselves off, or I won't. And we'll go from there.
All right, so we need a motion for Supervisor Bohn, just to.
Is there public comment on this, or is that just a?
There will be, but I was just get a motion before you go to public.
I'll make a motion to sit on it for one more meeting until we resign, or so the void is filled, I guess.
So how about you'll sit on it, and then if we change it, then
that's fine.
Won't sit on it. Okay,
that's fine.
So we have a motion, I believe, to put Supervisor Bohn on in that position on that committee. Is there a second?
I'll second.
Okay. All right, we have a motion, a second. We will go to the public. So our first speaker is 5288. And press *6 to unmute.
Hello, this is Kent Sawatsky. I'm really sorry that this has proved to be dysfunctional, and I obviously support, if we're going to participate at all, if John Bartholomew needs to be there. He has no conflict of interest, nothing but the county's interests at heart, and no perception of any kind of potentially trying to line his own pocket. I'm sorry that Steve Madrone feels is not willing to serve for one more meeting. Personally, I wouldn't even fill the seat until such time as you'd made your decision. There really isn't, and maybe even ask Steve to serve for one more time and John until that final thing is done, so there isn't any perception that someone's sitting there for their own personal gain. Appreciate the fact that Michelle Bushnell recused herself from the Measure S meeting yesterday. Rex should have also, and I feel it's also a conflict for that seat to be filled by someone who may have a perceived potential conflict of interest. That's the public perception out there, and it's quite prevalent. And so I wish these kind of organizations were more functional, but at this time, I see no reason to move forward and put someone else, change horses for the last hurrah or whatever it is in the middle of the stream. That's just my public comment. You may not get any others. I will be commenting, as you can see, on every topic today that's relevant, and I have taken my time to do my research and shall participate in the public process. Thank you for my opportunity to comment on this particular topic.
Great. Thank you, Kent. 3053, I believe that is Thomas. *6 to unmute and welcome.
Good morning, Thomas Mulder here. Can you hear me clearly?
Yes, we can.
All right, so I would support if it sounds like Supervisor Madrone doesn't want to go. I think the comments I heard from Supervisor Bohn of maybe the CCA trying to work towards tax reform within the state might actually be a good idea. So I think it would be valuable to sit there for at least a meeting and then see what your return on investment is as far as the 28,000. If there's tax incentives that could bring back revenue to the county, it might be worthwhile. What tax collector Bartholomew mentioned about the API thing, if the county is going to go down that road, they're also going to need to associate staff to track that data. I know as someone with a cannabis bank account, that is the API is something we have to provide the banking institutions that we bank with, and they have lots of full-time staff that track all that data and follow it and all that kind of stuff. So just remember, if you're going to want cultivators to give up that API to the CCA, then that's going to take a lot of staff also to follow behind on that if that's what you're trying to do. But I support the motion on the table. Thank you for the opportunity to speak.
Thank you, Thomas. Our next hand is, and our final hand, 6228. I believe that might be Madeline. Press *6. Welcome.
Good morning, supervisors, Madam Chair, Madeline DeLapp, Humboldt County Growers Alliance. I would like to throw our support behind Supervisor Rex Bohn to sit on the CCA. I do have a few questions though. My first question is, I would like if Tax Collector John Bartholomew could explain for the public a little bit more about the API and what is needed and what is currently not available. And I ask that because I understand that perhaps as the last several years, it has not really made a lot of sense for us to participate in the CCA. However, it may still be useful in the future if we can gather data within the county, and as the county potentially ponders a movement from a square footage tax to a gross receipts tax, if that is a direction that we want to go, perhaps this data could be useful. And then my other question is about, so this $28,000 a year for membership to the CCA, can those 7 counties negotiate a lower cost? Does this really cost CSAC $196,000 a year to administer? And are these participating counties getting the value for their contribution? And so I wonder, is it potential for the participating counties to come up with a lower dollar amount? And can the public review the bylaws for CCA so that we understand exactly what it is that we are participating in, and we understand the values that we're supposed to be receiving as a county? And finally, I just want to say thank you to our supervisors for really making that significant tax cut for cannabis farmers yesterday. And back to Supervisor Bohn, if his participation with the CCA and RCRC can be used to secure state cannabis tax cultivation tax relief, that would be wonderful. Thank you.
Thank you. All right, we'll go back to the board. We have a motion for Supervisor Bohn to serve on the committee. There's been a second. I think we can probably do a roll call vote. I don't see any hands up. Unless, I don't know, do we want tax collector? I mean, there was a couple questions there. Do you want to take the moment and see if you can answer that? Sorry, John.
Chair Bass, I will chime in, and Madeline brings up some good questions, and the data that is available through the CCA platform is very granular and provides a lot of detail. And that has to do with all the cultivators that, and I shouldn't say just cultivators, because it's any business that is using an API key with metric system. And I don't know exactly who all is involved there, but the cost for participation on the CCA by each county is either $7,000 per quarter if the data is not being uploaded from the API keys onto the system. And if the data is being uploaded, then it's based on a usage fee from each cultivator. And my understanding is most, if not all, the counties are picking up that fee that the cultivators would normally need to pay for their data being used on the CCA platform. And by the way, I think it would be fantastic if Humboldt County did require that cultivators pass along their API keys to Metric, and that then the county could have all that data available to it for really having a clear understanding of the product that's being sold through the legal market. The platform is really quite amazing. A gentleman named Adam Crabtree developed it and has a company out of Colorado that runs it, and they're involved in a number of different states across the country for this data. So I am in no way, shape, or form saying that the platform itself is not worthy of consideration. I think it's a great platform. But if Humboldt County is not going to go down the road of requiring cultivators to participate on the platform, then the data is not being generated for the county to use. And so that's where I'm coming from. The CCA is working with the state to try to get a reasonable cannabis tax established at the state level. And I know Nicole Elliott has been working with the executive director, Greg Turner of the CCA, to work on various things. And the CCA is truly in support of and trying to bring the cannabis economy into the rest of the business economy throughout the state. So that's a great organization. And I would love for the county to stay in it. But if we're not going to truly participate, the value of the information is not there. That's where I'm coming from. Thank you.
Right. Well, and I think, again, our focus today is just putting someone on the committee. So I think this is a bigger conversation to come back. Supervisor Bohn?
Well, John, I appreciate that because I did a little follow-up and I heard this is a tale of two stories. I mean, and I appreciate you doing the follow-up because I understand the pitfalls. And then I understand the opportunity for success. And I'm willing to put in the time. I'm willing to be the participant that gets us that success. And I think by using my position and not my position, but my relationship with RCRC and the people there, Sarah Ducat and that group, I think I can bring a little bit to the table that, not that it hasn't been there. I've just got a little more time and effort and have talked with the assembly on these things. And I think that with your help, that we can maybe ramp it up so we do get the information. So it's a tool that is to our benefit rather than something that just sits out there fallow. And I'll make that commitment with all my spare time, but I know that you're a busy guy, but I know we talk enough where I think we could probably accomplish something, or in 6 months come back and say, you're right, we're not getting anywhere. And I'm not one afraid to say this isn't working, but I would give it a shot because the idea of what you said with Nicole Elliott from the DCC and trying to get a tax situation that's fair, comparable across the board. So it's the biggest problem we heard everything is the level playing field. They're charging. They let the people do. I think a level playing field along these ways would be great. So I kind of look forward to working with you and seeing if we can do the second half. So that's my feelings on it. If we want to bring it back and get out of it, I understand that too, but it sounds like we've got a tool in our toolbox we're not using.
All right. I saw the county council come on, so I figured we were going a little far afield of this one item, and I was trying to derail Supervisor Bohn, but I wasn't able to. Is that why you're on here, Jefferson?
Yes, Chair. I think it needs to come back to the appointment.
Yeah. All right. So we have a motion for an appointment. We have a second. We've had a lot of extra comment that we'll hear it another time, and I think we'll just do a roll call vote, if we may.
Guess I should take it off mute. Sorry about that. Supervisor Bohn?
Sure.
Supervisor Bushnell?
Yes.
Supervisor Wilson?
Yes.
Supervisor Madrone?
No.
And Supervisor Bass?
Yes.
Thank you. Motion passes 4-1.
All right, so we do have a 10 o'clock time set, and that comes to us from DHHS, the Public Health Branch, and it is an update on local conditions surrounding COVID. And so at this time, I see Sophia's picture up, and I'm sure the rest of the team is there. So Sophia, I'll hand this over to you.
Great. Thank you, Chair, and your board. Good morning. I'm going to share my screen real quick. We have a PowerPoint presentation that we'll go through. So hold on just a moment. Okay. Oh gosh. Okay. Okay. This is the PowerPoint. I'm not showing a baby slideshow.
Communications 101. Start with the baby picture. It'll soften everybody up.
There we go. Okay. And I think you can see the PowerPoint now.
Yeah.
Okay, great. So good morning, your board. I have here, so I'm Sophia Pereira, Public Health Director. I have here with me our Health Officer, Dr. Hoffman, and also have from Providence, Humboldt, the Chief Executive, Dr. Roberta Luskin-Hawk, and Providence of Northern California's Government Affairs Manager, Mr. Ernesto Olivares. So we'll be doing a presentation today giving an update on the state of the COVID response, but also doing a little bit of a retrospective given that we're about 2 years from when we had our first case in Humboldt County. So we'll talk a little bit of some of the costs of the incident, the staffing, then I'll turn it over to Dr. Hoffman to talk about the impact of our efforts over these past 2 years, what we know right now and how that's informing some of our next steps. And then we'll turn it over to our hospital colleagues for a hospital update. And then obviously have time for questions at the end. If you have any questions throughout the presentation, feel free to chime in, of course, as well. So this is a timeline that is not exhaustive of what has occurred over the past 2 years, but I thought it was important to highlight, early in 2020, when this pandemic was just getting started, we had our first case in Humboldt County. We activated our Department Operations Center, and that was in February, March. States of emergencies were declared locally and statewide. The statewide shelter-in-place order was put into effect along with masking orders in April. In May, we had our first local COVID-19 death. And during this time, we developed a PPE distribution system for our COVID-19 responders in our healthcare system. We saw the blueprint that the state instituted in August of 2020. That was that tiered system that had, varying levels of restrictions based on, variety of data. And then in December of 2020, we administered our first COVID-19 vaccine. So early 2021 was really focused on scaling up that vaccination effort. And during that spring, we even had state resources bring in a team of 40 people to help with our mass vaccination sites. And that was a really important step with our vaccine effort. While there were some statewide surges, the prevention measures that we had instituted, we didn't see the same large surges that other communities had seen across the state. However, after the blueprint had ended and we had lifted up our masking orders, Delta hit in August. So that was the largest surge that we had here locally. We reinstated our local masking order. Another really important medical intervention that came during that time period was monoclonal antibody treatments. And so that clinic did get opened up at St. Joseph's Hospital, I believe in September. And then at the end of 2021, we saw Omicron occur. And so the statewide masking order was also reinstated. And then in January of this year, the surge has continued, but we also have seen other medical interventions arrive, like oral therapeutics are now more available. and at-home tests are now something that's more available, and the federal government has been offering up free tests to households. So that's just a bit of a timeline of how we've transitioned through this pandemic. Also just wanted to note some of the costs and some of the funding that we've received as public health. So to put it in context, at the beginning of this incident, between February to June of 2020, we spent about $4.5 million, and this is coming out of public health funds, and received only about 1.3 million in funds for the COVID response. In fiscal year 2020-2021, we spent about 10.5 million and received about 4.6 million in COVID response funds. And then for this fiscal year, fortunately, several grants did come through to public health to help with these COVID-related expenditures. And some of these funds will roll over into future fiscal years. And these grants support public health infrastructure, supporting the COVID response, but fundamentally that public health infrastructure. So the expansion of our public health lab, creation of a health equity program, which is something we've used to improve equity of vaccine access, for example, and then also supporting our schools. And then just since we're at that mid-year point, so far we've spent about $2.2 million on salaries and benefits. A portion of that has been claimed to these grants where we could, and the rest we hope to claim to FEMA. But again, these are coming out of the public health fund. And so then just with staffing, really quick, just want to note at the beginning of this incident, our communicable disease program in public health had 2 public health nurses, 1 communicable disease investigator under the supervision of a supervising public health nurse. During that time, the incident scaled up to a peak of having about 145 people assigned to the incident in spring of 2020. It's steadily declined since then. Today, we have about 65 county staff, not including the staff nurse vaccination team, the 10 people from Public Health Institute, and some state redirected staff. But our communicable disease program now has 6 public health nurses, 7 communicable disease investigators under that supervising public health nurse. So the importance of this is it allows not only for our staff to focus on COVID, but also all the other communicable diseases that we have circulating in our community, like syphilis, like tuberculosis. Not all of these positions noted are permanent positions. Some of them are extra help. So I just wanted to note that as well. So now I will turn it over to Dr. Hoffman.
Thanks, Director Pereira. Thank you, Board, for having us here today for the update. As Sophia mentioned, I'm going to talk a little bit about more of the data behind what the timeline that Sophia just went through and some of the achievements that we've been able to see through that work here in the county, both at public health and in the medical community and the community at large. This first graph we're showing you here is showing populous states, and just want to point out here that California has consistently done much better than other states in regards to COVID deaths. So you see here, the purple line is our COVID deaths for California, and we consistently have come in lower. And CDPH has attributed this to our consistent public health message and our public health interventions that have protected the public throughout this and really allowed us more time to get interventions out there through vaccinations and therapeutics like monoclonal antibodies and now the oral antivirals that are available. Next slide, please. So this shows us a little bit more granular on the Humboldt County level, what those deaths look like in terms of compared to other jurisdictions. We've consistently done better than even the state on many of the metrics throughout the pandemic. And our hospitalizations and deaths locally have been about half the rate of the state total. And when we compare it to other counties in California and other counties in other states, Humboldt County's had around 3 to 6 times fewer COVID-19 deaths. And just to try to put that into perspective, what that means, if we had 3 times higher deaths from COVID-19, that would be equal to all the number of cancer deaths in Humboldt County for 1 year. So essentially saving all lives from cancer for 1 year. If we were looking at 6 times as many deaths from COVID-19, that would equal all cancer deaths for Humboldt County in 1 year, plus all heart disease, stroke, motor vehicle crashes, suicides, and homicides combined. Next slide, please. This slide is showing us nationwide data from previous cold and flu seasons compared to when COVID-19 began. And you can see here the 2 blue arrows. So 2017, 2018 was considered to be a really bad flu year for flu deaths. And then we see as we enter 2020 through today, the huge spike in deaths. It really shows you here visually how different this is than typical cold and flu year, even a bad cold and flu year. Next slide, please. This is some local data that we put together. It's a little over a month old now, but I think it still shows the point that we have seen an impact on our local residents and even in our younger residents. So it's not only those who are older who are at risk. In Humboldt County, as of mid-December, we had a total of 120 hospitalizations under the age of 50. And that was about a quarter of all hospitalizations at that point for the county. A third of those under 50 hospitalizations were ICU patients. And of significant note is that none of them were fully vaccinated and only 2 of them were partially vaccinated. The average age of those under 50 hospitalizations was 37 and a half. Next slide, please. Moving on to masking. Masking has obviously been a really important policy throughout the pandemic. This was a study completed by the CDC, which really shows how effective masking has been to protect our public institutions and keep schools and other public places open. A 3.5 times higher likelihood of getting COVID-19 in schools that did not have a masking policy. Next slide, please. The vaccination program, we showed some local data. This is national data at the 1 year mark. So back in November, this retrospective study looked and approximated that 1.1 million additional deaths would have occurred in the US and 10.3 million additional COVID-19 hospitalizations had we not had the vaccination effort. And so clearly the vaccine, masking, and other policies have had tremendous impact throughout the pandemic. Next slide, please. Locally, this a lot of data on this. I'm just going to highlight a couple of things. The first thing is vaccination has gone really well in our county. I think when you look at the state, we are on par with the state. You can see here that this is a color map. The dark blue shows those places that have over 70% of the population with at least 1 shot. And so we're at 71.2% as of last week, on par with the rest of the state. For other important metrics like boosters and in vulnerable populations, we're actually ahead of the state median. So nearly 10% for boosters, and in certain populations that are at higher risk, like Black and Latino. We've done a lot of work on making sure that we get access to vaccination to everyone in our county, including working closely with community-based organizations who have helped us increase the vaccine coverage in these communities for both primary vaccine series and for boosters. Next slide, please. And so where do we go? Sophia kind of went on the timeline of, we started with closures and physical distancing. We moved through the blueprint. We've moved through isolation and quarantine, removing our local isolation and quarantine order, relying on state and federal recommendations, really relying more on other strategies going forward, like masking, testing, vaccination, and ventilation. The state has just announced yesterday that they will revert back to the pre-December 15th statewide masking order, which means that there will not be a requirement for masking in all public places. And we in Humboldt County are planning to align with the state on that. So removing our local masking order going forward and aligning with CDC and CDPH on masking requirements and recommendations. And really relying more on testing, ventilation, and vaccination going forward. Next slide, please. So where do we go from here with the pandemic? Given what we know, we're gonna likely, these are ideas and nothing is set in stone. I think, we always have to look at the data and respond appropriately, but I think what we're seeing is more at-home tests and more at-home treatments. This is shifting the burden away from the hospitals and the medical system, allowing people to take care of this more as they would a cold or flu by home treatments. Continued reliance on vaccines to reduce hospitalizations and deaths and slow the spread. Probably more boosters in the future. Potentially variant-specific vaccines that will come out. And really for public health interventions, moving away from policies that are requirements and towards more recommendations, education, community engagement. We'll continue to monitor for new variants and make changes as necessary based on what we know about the characteristics of future variants, with the ability to be flexible and able to remove or re-implement policies based on whatever happens with future variants and the behavior of the virus. So again, overall policy trends are towards less restrictions and have been throughout the pandemic, towards more reliance on recommendations, collective responsibility, education as the pandemic progresses, and an emphasis on vaccinating, masking, testing, and improving ventilation going forward. And with that, thank you.
And I see Supervisor Bohn, did you have a question? Sorry.
Yeah, I did, because you said something about masking and the CDPH and everything else, and there was a pretty good statement or press release the governor put out in conjunction with the CDPH last night that I know you guys have combed over, and you mentioned you're going to follow. There's a lot of interest in that article I've noticed in the last 12, 16 hours since it came out. Can you tell what that means for our schools, our gatherings, our workforce, and where we're going on that? Because we went over it really quick, but it sure seems like it's a pretty big statement the governor said. And I mean, in all fairness, he probably hasn't helped any of your jobs with his getting caught without a mask, which I understand wholly. And I would be remiss if I didn't say you guys have caught a lot of crap over the last couple of years. I don't think we can say enough about how you've saved lives, tried to save lives. Roberta with the hospitals in Mad River, everybody has been over backwards. I remember when they had people lined up at Walmart to go into or not Walmart, but Winco to go into the store, and they'd only let 10 shoppers at a time in there and things like that. We've come a long way. I appreciate everything you've done because you have saved lives. We have saved lives. It hasn't been easy. We're going to hear how uneasy it's been for you, I'm sure, but I I appreciate it. I believe in the vaccine. I'm getting just as tired as I know you guys are and can't beat the bandwagon of the mask, but in times and places that I understand in those situations it's necessary. But with what was said last night, I would love to hear a little bit more, because that was a pretty big statement the governor made and we kind of glossed over it that said, we'll follow what he says. What did he say in your mind?
So, you know, I do want to make sure we have time for Dr. Leskenhawk and the folks from the hospital. You know, we will be doing a press conference tomorrow and going over this, I think, in a lot more detail. But essentially, by removing our local masking order, we will align with all CDC and CDPH requirements and recommendations. You know, there will still be settings that require masks of everyone, regardless of vaccination status, and those will be schools, hospitals, skilled nursing facilities, other healthcare facilities that, you know, required it before December 15th and before August 7th, when we put in our local masking order.
So, and just one follow-up, and I read that, but schools will be included too. I saw the health and everything else, but schools will be included?
Schools will still require universal masking, and there is no date that we know of right now for that.
All right, okay. Thank you very much for the follow-up on that.
Yeah. I'll turn it back over to Sophia, and yeah, thank you, and happy to answer questions once Dr. Leskenhawk and Ernesto have a chance to present.
Yeah, Dr. Leskenhawk, if you want to go ahead for your hospital update.
Sure, happy to do that. Yeah, and first of all, I want to share my my gratitude for our public health officials who often in difficult times, we really partnered together. But, you know, it was like February 20th of 2020 when we saw the first case in our ED and in our ER at St. Joe's. And frankly, it took a very long time before we started seeing more and more cases because the community partnered with us to socially distance and wear masks. And while those were very difficult times, it gave us time to prepare. I would say that as an organization, I run the hospital part of Providence here. There's also the medical group, home and community care. And you saw interventions every step of the way. I think we stepped up. The healthcare community collaborated across, whether it's Open Door or Mad River or others. St. Joe's was in a unique position. Our medical group really ramped up virtual visits so that people could be seen. Our home and community care offered at-home monitoring for people who were in our ER but well enough to go home, where we could monitor their oxygen and a nurse called daily. But since St. Joseph is the only hospital in our county that has board certified intensivists who really have the training to handle these very challenging, severely ill patients with COVID who are on ventilators, we saw the bulk of the sickest patients at St. Joe's, a number of them at Redwood, also a number at Mad River, where our caregivers, nurses, doctors, pharmacists, respiratory therapists really have stepped up to provide current state-of-the-art care. Everything that was available at any major academic center in the country really was available in our community, which I think is really important. Our facilities folks transformed our hospitals by putting in negative pressure isolation rooms and giving us safe spaces where our caregivers could care for patients. And so that was a big deal. And then as we went through the various surges, it was really last August and September when we hit our max, where across St. Joe's and Redwood, we had 38 patients at one point, inpatients, and which is a huge proportion of our number of beds. And then that came down with the Delta surge. We saw a significant number of deaths and hospitalizations, and primarily in people who are unvaccinated. With Omicron, we've seen a variety of things different. We know that with the current surge that the risk of hospitalization and death is lower, but a lot more people were infected. And so today, for instance, I think we have 16 patients at St. Joe's and 3 at Redwood. I'm sure there's some at Mad River too, never hitting that August, September peak, but still numbers of patients who are material. Part of the way that's been driven down is increased vaccination for sure. And we opened up our monoclonal antibody clinic. So we've treated over 600 people who got COVID were at increased risk of hospitalization or death because they had underlying disease or because of their age or immunodeficiency. And that's had a dramatic impact in reducing the risk of hospitalization initially from Delta. And then as we switched to Omicron, using different antibodies, some drug therapy like remdesivir, and now even an oral antiviral, which is being distributed through our ambulatory care program for patients at the highest risk of hospitalization. So I think we've addressed the pandemic with every possible intervention and very much in a collaborative way across the county. While we've done that, we've ensured that we could safely continue cancer care and cardiac care. Our elective surgeries were reduced in December and January because we had two things happen. Both we needed to redeploy some nurses and others to help with inpatients, as well as in January, we saw some of our staff going out with COVID since the Omicron was so contagious. And so you will have seen or heard that we have certain services that suddenly were less available, longer waits. But we're very pleased that we've been able to bring in more traveling staff. Our workforce is healthier again, having either gotten through the COVID or taken additional precautions so they never got it. And our surgeries are opened up and imaging is increasing. We have experienced what the country has experienced is there is a national workforce shortage, which is substantial. The Great Resignation of 2021, which affected all industries, had a significant impact on healthcare. So we are continuing to recruit and work to retain the best healthcare workers. We bring in travelers where we can. It's important to note that the economic consequence of this for the hospitals is pretty severe. As we bring in travelers that are in incredibly high rates, and as we reduce things like surgeries that help pay the bills, taking care of a COVID patient usually happens at a loss. And despite funds that have come in through federal support, Providence and our local hospitals have seen losses associated with providing this care. We're here to do the right thing, and we're anxious to pivot more towards life as usual, and that's starting to happen already. But I'm available to answer questions if there are some.
Well, I know Supervisor Bohn has a question, but Supervisor Bohn, hold on. I didn't know Supervisor Bohn, can you wait until after Ernesto speaks?
I didn't lower my hand. Sorry.
Okay.
I just can't reiterate the job that all our health professionals have done the last 2 years. I mean, it's been hard on us. I can imagine on them. They actually have to live it.
All right, thank you. So Roberta, I think, were you going to hand this over to Ernesto now?
No, Ernesto is just joining me, I think, to visit. I don't think he was planning to say anything, just to join us. So no, and I think I will say in terms of our caregivers, if you talk to our ICU nurses, if you talk to many frontline caregivers in our emergency room, they are exhausted. One of the things they are seeing sometimes is they'll see people frustrated that the pandemic's happening at all, that we have rules around visitation, which were meant to protect people, or just that at times when we have staff out, that we're trying to manage all the acute care needs of the county and those things that only we do. So I would just ask for some grace and to continue the gratitude towards our people who are on the front lines, because they're exhausted and they deserve our thanks every day.
I see Supervisor Madrone's hand is up on purpose, right?
Thank you, Chair. Yeah, I just too want to add to the chorus of thank yous for our care providers, our nurses, our doctors, everybody in our facilities, because, as we all know, 2 years, this has just gone on a long time. We're all at our rope's end, it's frustrating. People are angry, stressed, and I get it, but taking it out on our healthcare providers, that's just not okay. And, I recognize that everybody has different opinions about this whole thing and what you should do or shouldn't do. And I respect that. We're going to get a bunch of public comment here. But, one of the things I just want to say is that it's not fake news that vaccinations have reduced hospitalizations and deaths. That is not fake news. That is documentable. it's not fake news that our staff in hospitals are burned out, as Roberta Luskin has just said. And so, you know, for all the things that everybody says about us as a board, I know this board really struggles very hard with not struggles, but works really hard to try and understand all the various data and reports and information that we get from everybody in the community. And we weigh through that. We try to make the best decisions we can. So I just ask that people really consider that it's simply not fake news what's going on in these hospitals. And to pretend otherwise is really a tremendous disservice to our community. So I, for one, and I know this board, are very grateful to everybody in our community that stepped up to keep each other safe, whatever that looks like, you know, in your own way. And so I just want to say a big thank you to all of us for hanging in there as a community. And we are going to see our way through all this. So I look forward to that day like all of us do. Thank you.
Thank you, Representative Madrone.
And I don't see any other panelists have a question at the moment. So Sophia, is this, I mean, I want to say thank you also for being here, but I figure we might have some more talking to do. Sophia, do you have any more in the presentation, or would it be a good time to take public comment?
Yep, that concludes our presentation. Thank you, Chair Bass.
All right, so we will go over to public comment, and we have a couple hands up. I know we'll have a few. So first one.
Hello, can you hear me?
Almost. Hold on, Ash. I didn't actually call on you yet,
Okay.
but I do believe you're the right one. I'm just trying to get my cursor there. All right, go ahead, Ash. Welcome.
Okay, so I kind of going back to what I was saying earlier when I first commented today on the virtual meetings, like just the annual mortality from all causes. It's lower in 2020 than it was in 2019, and 2020 is like the height of the pandemic here. So this goes to the national thing that Biden's saying now is the problem that we're seeing is hospitalizations from COVID versus with COVID, which is just implying that there's something wrong with the tests. So I just want to know if there is any local effort to sort this data out. And also, is there complete annual mortality from all causes for 2021 yet? Because I put in a public records request and I only got a partial through September. And also I was wondering, are there records of vaccination status for all deaths since the onset of vaccination? Like every death in the county, are we tracking this? We should be. It's a new thing. Also, is there records of patients that were treated on ventilators and remdesivir, who resulted in deaths? Are we tracking that as well? So if I could get some answers to those questions, I would really appreciate it. Thank you.
All right.
From the pure hospital and clinical side, I just want to.
Well, actually, Roberta, we'll come. Yeah, no, we don't. We're going to finish public comment, then we'll come back to get answers.
Okay, sounds good.
All right, cool. Sorry, I should have said that. All right, so the next public speaker is 1041. I believe that's Donnie. Press star 6 to unmute and welcome.
Hello, can you hear me?
Yep.
All right. Yeah, so my name is Donnie Creekmore. I'm out here in McKinleyville, Humboldt Freedom Coalition, HumboldtFC.com. I'd like to speak towards, I just sat here and listened and was fascinated with Ian Hoffman's presentation. He shows graph 1, which to me shows a nearly equal death curve amongst all the different states that he shows and counties. Graph 2, he claims 3x to 6x deaths in other counties, but he is acting as if geographical spread of constituents in those counties compared to Humboldt is not a factor when it obviously is. More rural counties are going to have less potential of spreading a virus because we're just separated from each other by distance of ground. And so it has nothing to do with the failed policies of pushing the vaccinations. The one thing I did notice, though, is that he didn't show his vaccinated versus unvaccinated graph, which he has been so proud to show in the past. And I understand why. It's because it's showing that basically on this last Omicron thing that there's a co-equal case rate between the vaccinated and the unvaccinated, which clearly shows with data and science that the vaccines absolutely do not prevent transmission and therefore have no justification for any kind of applause at all. Like, I mean, I respect you guys and your opinions that, you know, you like the vaccines and you think that they're great and all, but the science just doesn't back your opinions anymore. Yeah, his forecast of deaths also, if no one was to get vaccinated, is ridiculous speculation at best. There's nothing to predicate that on. He lays it all out for you, and you all rely on everything but your own leadership. And today is the day that you need to stop sitting on your hands and reject his nonsense and remove all of this ridiculous mandates, which only serve to prop up the failed policies of the Biden administration, which everything to date has been just a copy and paste of. His entire emphasis is on policy that has completely failed. I will not comply with this, and I will preach peaceful noncompliance to my followers as well. I've got some questions though. The preponderance of evidence and the data clearly shows children and young people are not vulnerable populations to COVID-19, nor are they likely vectors to its community spread. However, the strictest masking policy still exists here in Humboldt County for our students who are in the safest ages in regard to COVID-19 vulnerability. How does the board as well as the DHHS justify these inconsistencies? How does a meal and or a drink justify a complete divorce from indoor masking for adults, while students are not even allowed to wear masks that their parents purchased for them without confrontation by the school who claims that they are just following the lead of the DHHS? On what specific measurements of data does the board and DHHS predicate the notion that there is an emergency locally in the county in regard to COVID-19? Based directly on HumboldtGov.org COVID-19 dashboard, everyone under 59 years of age has less than a 1% chance of death from COVID-19 based on collected case counts. And of this same group, they have a 5% or less chance of being hospitalized due to...
Sorry, Donnie. I'm sorry, the time, 3 minutes go fast. Sorry about that. Our next speaker is 0151. If that's you, press *6 to unmute and you'll have 3 minutes.
Good morning. I think that that your passage of the reduction of tax for the cannabis industry is critical. I think it's great that you're trying to help out.
Dottie. We're on the cannabis update. Are you trying to talk public comment on general public comment?
COVID update, not cannabis.
Sorry.
Yeah, we're on COVID.
So the public comment is coming next, or?
Okay, public comment is at the end of the meeting. Remember, it's been moved, and so we have 2 other items. So yes.
Okay, great.
Thank you. Okay. All right. Bye-bye. Thanks, Dottie. All right. We're going to go to 5457, and if you are wanting to speak on the COVID-19 update, please press *6 to unmute.
Yeah. Thank you. Lori Birdsong here, Arcata. I appreciate this opportunity to speak, and I'm just concerned because with the public health policies, there hasn't been any educational efforts in preventative measures. What about, informing people about taking vitamin D? What about the fact that kids have a 1% chance of contracting COVID, that they should not be wearing masks in school? Masks are detrimental to their immune system, decrease their lack of oxygen. What about uses of ivermectin, hydroxychloroquine? I didn't hear any mention of that. There's been numerous peer-reviewed studies on the use of ivermectin and the successful use of ivermectin along with other remedies, hydroxychloroquine, vitamin C, and remdesivir. I'm horrified to hear of remdesivir because it causes kidney failure. It should not be used. It failed its own tests when it was being tested for whatever purpose it was prescribed for, not for COVID-19. And I also want to relay a horror story that I heard of couple in our community. The woman was ill, went to the hospital. She had stomach problems. No signs of COVID-19. They tested her. Oh, you test positive for COVID. She's not suffering from any COVID symptoms, and they proceed to give her injections. She didn't know of what, and then her husband gets in the hospital. They put him. He was fine, and then they proceeded to demise his health with injections. They ended up putting him on remdesivir, which causes kidney failure, intubating him, and then he died. It was just a horror story because these people were active, they were healthy, they were fit. There was the treatment. I would call into question why we aren't promoting health measures, good health, eating organic food, getting exercise, being outside, breathing fresh air without masks, getting our children socially engaged. It's a little askew, and I also have to question the definition of vaccine or unvaccinated deaths, because the definition of a vaccinated person has been changed. If you are less than 2 weeks out from your vaccine, you're an unvaccinated person.
Right.
So
All right. Thank you very much for calling in. And just a reminder, everyone, there's a 3-minute hard stop on the comments per person, just so we can treat everyone the same. And you'll hear that sound one beep, and that tells you have 30 seconds left. And hopefully, because I don't like muting people, but we do have those policies to follow here. So we're going to go to 7094, and you can press *6 to unmute, and you will have 3 minutes.
Hi, this is Adam Lustig, Lost Coast Populist, calling in from District 4. As California goes, so goes the nation. That's a popular quote we've probably all heard before from our President Kennedy. But in this whole COVID thing, we're way behind. Countries and states all around the world have lifted all COVID restrictions, including the UK and Ireland, places that were way ahead of us with vaccination, and the Delta and Omicron. They all went through it, and they realized that none of that stuff worked. Johns Hopkins released a recent study showing the lockdowns were ineffective. You know, you got people like Leanna Wen and major mainstream people now saying cloth masks don't work. They never worked. That one study that Dr. Hoffman put up has been thoroughly debunked. I can send you a link with about 150 studies showing that the masks don't work. They don't work. And the vaccines don't prevent transmission. Even the head of the CDC, Ms. Walensky, has said that, and many others. They don't prevent infection. You know, you want to say they prevent hospitalization and death, but we had far more COVID deaths in 2021 with vaccines than we did in 2020 without vaccines. So, you know, to me, that's still up for debate. But, you know, people should have the choice and do what they want. But, you know, it's kind of funny, this lifting the mask mandate for the vaccinated. So you can take off your cloth mask that doesn't work anyways if you got the shot that doesn't prevent transmission or infection. I mean, make it make sense. It's just like another thing from this state government that just makes zero sense whatsoever. Probably why we're at or near the bottom in so many important metrics like unemployment or places to do business or education, etc. And finally, this thing with the kids. I mean, you got schools in Florida and Georgia that lifted their school mask mandates in August of 2020. If there was this overwhelming data showing that was dangerous, it would be on CNN every day, but it's not, because it didn't happen. The masking of school children is child abuse. It does more harm than good. You know, it's just silly that we're going through this because of, you know, I don't know, the unhealthy ego of some of our politicians and doctors that just can't admit they were wrong. And, you know, all that money that we spent, that Ms. Pereira went over, and we spent a lot more than we got back in grants. I don't know if the county can afford keep funding these failed COVID policies. They should all be done. We should not be testing asymptomatic people. No one should have to wear a mask. There shouldn't be a vax mandate anywhere. We should just, you know, admit we were wrong and get on with our lives. That would be the right thing to do, and I hope that's what gets done. Thank you.
Great, thank you, Adam. Okay, 5288, press star 6 to unmute. You have 3 minutes, Kent.
Hello, Kent Sawatsky, and I don't belong to groups. There's a group called the Anti-Vaxxers or something like that. In fact, I wouldn't belong to any group that had me as a member. I think that would be that's some guy named Mark said that once. Anyway, the interesting things I find here is that this group may come out to be 100% correct. I don't know. I'm not looking down that crystal ball. I do know some things that are really detrimental to everybody. One good thing of this, people have learned to communicate with their eyes. That's a good thing about the mask, but that's about the only good thing. People were meant to interact face to face, full facial contact, especially children. And so this has been extremely irritating to me. And now I've different news, so I think it was CNN, said that a lot of the states that are quote unquote were 100% masked are now allowing the children to go unmasked. And this lack of communication and lack of being able to interact with someone as we normal is very, very detrimental on a long-term basis. So I'm not going to crystal ball whether everything that this quote unquote group is telling you here is come to be correct, but there's a chance a significant part of it is. I do statistics, and I can basically slant a statistic or facts and figures any way I want to take a side, 100%. And I can also do it to have the 100% other side. So I was just curious. I saw something up there that said the Commonwealth Fund was at the bottom of one of the stats that were up there. And I don't know who that group is, but again, like I say, statistics can be maneuvered, manipulated, and I think we're in a world of hurt as far as our people go. I have all 3 vaccines. I've stayed masked, coming back on the airplane the whole time and follow the rules and regulations, and have no sign that I have COVID. I haven't had antibodies tested, which I probably should. I may have had it. Hopefully we're going to move on now. It's time for us to open up. It's time for us to get our children back into a real world where they can learn to socialize and interact on a normal basis. That's my biggest fear, are the children. So hopefully we will move forward in that. Hopefully my crystal ball says within 30 days or less, we will be headed down that road, thanks to Omicron, which has done a fantastic job of bringing the antibodies of a lot of people up to what they needed to be. So thank you for my opportunity to speak on this topic.
Great, thank you, Kent. We'll go to 0896, and then we'll move on to our last speaker. So 0896, press star 6 to unmute. Welcome. Are you there? Okay,
Can you hear me?
I can now, yes, welcome.
Okay, great. Thank you for the presentation, presenters. I found it very interesting. I am tuning into this presentation because I'm really confused. I looked at the presentation that showed that studies show that masks work, and I've certainly seen that, some information on that in terms of studies. But I'm confused. Why are we at this point in time removing the mask mandates? I find that really, are we saying that we no longer need to be careful? I mean, what exactly is going on? I do find this whole message unclear. And I'd like an explanation of why we would be removing the mask mandates when there's a surge still going on.
Okay, well, we can talk about that after we come back to the board. We can't do an answer.
Thank you.
You're welcome. All right, and 3053, Thomas, press star 6 to unmute.
Hello, Thomas Mulder here. I didn't presentation if locally we can supersede state guidelines as far as masking orders for children in the classrooms. The masking mandates will come after the 5th for everyone else, but why are we our children? Why are we not letting learn to use wire?
Hey, Thomas, we're having a hard time hearing you.
power, if the Board of Supervisors has the power to lift that mandate or direct the public health officer to lift that masking mandate for the youngest children, please do so. Thank you for the opportunity to speak.
Okay. Thank you, Thomas. All right, we have one more. Someone's not on mute. All right.
Roberta.
Okay, I can't see, not all the pictures are on the same page, so thank you. 0280, press *6 to unmute. Just press *6 to unmute, and you'll have 3 minutes. Welcome.
Hello.
Hi, welcome.
Hi, my name's Emily Mossman. I'm in Mike's district. I'm calling because I listened to the radio the other night, and Ian was on there saying that people need to put a cloth mask over their N95. I would like to see the study that shows that's effective. It sounds ludicrous. I would also like to point out that currently we are listening to Janet Woodcock, the head of the FDA, who approved an opioid that was 10 times stronger than Vicodin against the advice of all the FDA scientists. There is a rampant amount of regulatory capture currently in all of our institutions of us. And also, with Ian's presentation, the classification of a death from COVID has changed from pre-pandemic. Before, if you were dying from cancer and you got the flu, you didn't get marked down as dying from the flu. Currently, if you're dying from cancer and you get COVID, you get marked down as COVID. If you go into the hospital and you're sick from something else and you also have COVID, it's counted as a COVID hospitalization. How is this not talked about by the board? How are these classifications not discussed? And also, when we had the WIN project, we had town halls everywhere. We had many discussions. And here we haven't had one town hall pertaining to COVID. Not one virtual town hall, no community input other than what there are 3 minutes from public comment and our individual meetings that we have, which, it's kind of insane. So that's the thing that I request from the board. We need to have a town hall pertaining to COVID and all of the regulations around it. I also want to say the vaccination rate was 71.2, and that was just with one shot. So I'm wondering, how does that make sense to you all? The fact that seems very low to me. And the fact that there's only one shot, how many people had an adverse reaction and didn't get the second shot? We're not tracking this because nationwide, we're pretending like vaccine injuries don't exist. It's criminal. It really is. Also, Roberta, talking about remdesivir, that was terrifying. Also, you were talking about maintaining traveling health providers while you just pre-pandemic closed down part of the hospital in Fortuna, and during the town halls that were inaccessible to the community, and you made the meetings short and cut off people's comments and questions. And you fired people, healthcare providers, during that closure. So for you to talk about having a hard time maintaining.
Sorry, it's been 3 minutes. I apologize, but those 3 minutes do go fast. All right, we're going back to the board now. So I know that there were some questions asked, and I do apologize. I don't have you all on one screen because there's a lot of faces on here. Roberta, did you want to respond to any of what you might have heard, or does anyone else have? We had a few different questions in there.
Yeah, I think as an infectious disease doc, I really have tried to follow the science closely to provide the best care for this community. And I will say I'm convinced that the vaccine has dramatically decreased the number of cases of hospitalization and death. And while it doesn't, with the current strains, prevent people getting infected, it clearly continues to help prevent deaths and hospitalizations. And so I would just encourage people to keep an open mind and take advantage of what science offers from the standpoint of of the hospitals, I have to comment that everyone, when we merged to create one strong childbirth center that was renovated, where we reached out to our tribal communities and others to deliver culturally sensitive care, which was actually and has a level 2 NICU. Every single nurse who was in Fortuna working in that area was offered a job, either moving over to the child care center in Eureka or staying in Fortuna doing other things. Some stayed in the ER or the OR. So I think there is, sometimes it's easy to look at public health officials or hospital officials and question our motives. I will tell you, everyone is working tirelessly, getting the best information they can to provide everything we can to support this community. And I hope that's recognized on some level. It's across the board.
Right, thank you. So there were some other questions. Dr. Hoffman, Sophia, did you guys have anything to add? And then we'll go to the board. No, doesn't look like it.
Dr. Hoffman, would you be able to just go over briefly the masking order piece?
Sure. Yeah, going back to Supervisor Bohn's questions. So really what we're going back to is pre-August 7th. So the state CDPH changed the masking order at the state level on June 15th. We, at that point, aligned with the state and if you recall, that was the requirements for unvaccinated people to remain masked in public spaces, but those who are unvaccinated could choose to go without a mask if they wanted to. I will point out that the current recommendations from both the CDC and CDPH are that everyone continue to mask in public places when we have these high case rates that we have now. So when we're in the red or orange on that CDC tracker map, that we continue to mask. And so we're still currently in the red. So that recommendation is still there. But what changes is that the requirement is no longer there. So it will be up to each business and each public space to determine how they want to go forward, if they want to require masks or if they want to put up signage about, allowing people to basically self-attest with their mask. And then, as we already mentioned, the specific settings that are more vulnerable settings where, there's either more vulnerable people or, groups that would spend a larger amount of time together, like in congregate living situations, jails, schools where kids are in school all day long. Those settings all still require masks.
Great, thank you. We do have Supervisor Bohn and Supervisor Wilson with their hands up.
Again, I think, Roberta, a lot of people do notice what the effort you guys have made. I mean, I don't know, I'll reiterate, I don't know if Humboldt County realizes how lucky they were to have an infectious disease specialist as their CEO of the hospital when this all came down. That wasn't planned, but it certainly did help for our health officers to turn to somebody. And again, vaccines, we discussed it. I've been on the vaccine bandwagon since day one. They do work. There's scientific proof they work. I mean, you can debunk anything. You can debunk my existence if you look at the internet enough. I'm a figment. But I'm just saying, you asked if people, you hoped people realized the work that our medical professionals do. We do. Without a doubt, we do, all the way down to your nursing staff, which I have so many of those people as friends, and they know the efforts being made. And it's not fun when somebody has to go to the emergency room and then they have to go outside because there's concerns. But the efforts you guys make on those, I've heard, are wonderful. So we are hearing it. And if our board can assist in any way, and we're going to get through this, people are tired. People are tired, even, and it was stated earlier that look at the numbers from 59 and under. They're not going to die. Well, I'd be really excited to look at those numbers if I was 59 or under, but hey, I'm on the other side, and I've got two very good friends that died. They were healthy till they got COVID, and they both passed away. And I've got numerous that had other ailments, but they were perfectly healthy going in, and they're no longer with us. And it's hard for me not to support what you guys are doing and think of them at the same time. So it's real. And I think we're making efforts. And again, the same soapbox I said last time, I appreciate the efforts everybody's doing. I just want it to be over just like everybody else.
Supervisor Wilson.
Thank you, Chair Bass. I want to thank the staff and especially our public health staff here today. I just want to reiterate the gallant efforts and how much we've gone through, how much we've learned, how much we've had to transition and pivot, and in terms of the change in information and the change in the virus itself as well. We've had to adapt to that and adapt to the conditions socially as well, and all of these things. And has not been easy. And it's easy for some folks to say, I was right about this or right about that, but as they say, broken clock, right, twice a day. And none of these things that we have done in all of this, I would say, has been perfect or universally loved, because these are not perfect times, and these are not, and we're doing our best. But the numbers and what we get from the modeling can show us that there has been a vast success. And I want to reiterate just since the vaccination has come in, almost 2 million people. I guess no. Well, was it 1.7? Can you remind me again what it was? It was 1 point something million people that have been saved through vaccination. The over 10 million people that have been spared going to the hospital. I want to say, and that doesn't even get into the people who just didn't get seriously ill that didn't go to the hospital. Millions and millions of people were saved that hardship, that economic impact, that the stress from that. And I want to say that the vaccination has done an amazing job. And in so much of it is in what we don't see. It's just what we don't see. I mean, I don't know how many of my friends have been saved because they got saved. They got vaccinated and they didn't go to the hospital and they didn't die, right? And so so much of our success is in that. And so I just want to say thank you so much for that. There's one question for you. When this mask mandate is on track to be lifted, should a private business still want to require a mask in their business? Is that something that's available to them?
Yeah, great question. Thanks, Supervisor Wilson. So just like it was on June 15th, basically think back to those days. That's where we're at on February 16th. So we have the signage available on the Humboldt Health Alert website for the different options. Masks are required here. Certainly people can continue to do that, or they could revert back to, the self-attestation. And I just, would continue to remind everyone that given the CDC's recommendations, Humboldt County Public Health will continue to recommend masking in public places for all until those levels come down.
Sorry about that. Thanks for that. And I just reiterating how much I appreciate the work that's been done here, and how all of these measures, whether it's masking or vaccinations or whatever, none of them are absolute. They all work in a system to lower our risk. And we're just moving, and I really feel I'm hopeful that we're moving into that space. We're really hearing about where this is moving in, hopefully into an endemic space where we're managing it in a way that was expected, right? This is the trajectory that we're hoping for, and that we've seen in the past for these kinds of pandemics. And I think that, and let's hope that that's the way that it moves. And thanks a lot. Hopefully we'll get through this as soon as possible.
I was going to say, I think a lot's already been said, and I know you guys are all really busy, both everyone from public health and from the hospital. So I do appreciate that you were all here to do this update. And I just don't want to keep you. I think you've actually been with probably the whole 2 hours of our meeting. So I know it's a lot of time for you guys to spend. Are there any other final comments from the board before we just receive and file this report? No, I'm not seeing any. All right, well, let's, I don't think I need a motion. I think I could just do it without objection, but would someone like to make a motion just so it makes it easier on Nikki?
Sure, I'll make a motion to receive and file this report.
Rex, is a second? Okay. Yep. Okay. Thank you. Nikki, can we please have a roll call vote?
Thank you all. Appreciate it.
Supervisor Bohn.
Sounds like Roberta's sick. I don't want to say anything, but yes.
Supervisor Bass.
Yes.
Supervisor Bushnell.
Yes.
Supervisor Madrone.
Yes.
And Supervisor Wilson.
Yes.
Thank you all. Have a nice day, Roberta.
Thank you all for being with us today. I need to take a quick break. So a 5-minute break, 10-minute break. Anyone else care to chime in on that? Supervisor Wilson?
How much more how long do you think we're going to be after this?
Oh, you don't want to ask that. I just need a 5-minute break. I literally have to have a 5-minute break, if nothing else. Okay.
Let's do 10 minutes and then we can get some coffee and things.
Okay, 10 minutes. So we'll be back at 11:22. All right, so
Supervisor Wilson's on his way back.
Okay, and we do have 3 of us, so I'll talk slowly and we'll get started. Oh boy. Thanks, Rex. Okay.
Thank you.
So we're going to head on to our, we have a public hearing today, and this one comes to us from the Sheriff's Office. And it's a hearing to provide the annual submission of the data pertaining to immigration and customs enforcement. And I think at this time, I'll open the public hearing, and I will, I see the sheriff and I see Twain also. So welcome, Sheriff Hansel.
Thank you, Chair Bass. I appreciate the opportunity to bring this to the board and have a public hearing. I have Captain Dwayne Christian also with me to answer any questions and to also support this forum. So as you're aware, the Sheriff's Office, in conjunction with the Truth Act and Measure K, is required to have a public forum to report out data pertaining to immigration and customs enforcement access to our correctional facility. So there are several things that we track during the course of a year, and twice annually we come out and we have a public hearing at the Board of Supervisors to talk about those stats and how many times the Immigration and Customs Enforcement has accessed our correctional facility. So there's several things. We track 7 points. This data is a part of the presentation and is part of the board packet. So you'll be able to look at that more intensively. But just to report out some of the stats, we received last year in 2021 a total of 6 ICE administrative detainers to our correctional facility. 1 detainer received did pertain to an inmate that had a qualifying offense. The number of individuals that were released prior to the detainer were 4. And there were no ICE interviews requested, provided we did not provide any release dates to ICE. There were no persons that were turned over to ICE, and number of individuals with qualifying offenses in custody is 0 at this point in time. So that would conclude the data that we're supposed to report out in the public forum. And I'm here to answer any questions regarding that data that, that you all might have.
All right, Supervisor Bohn.
And I tried to pull up the last record, Sheriff Hansel, but these are almost the same exact. I don't know. Have we turned over anybody to ICE in the last 3 years?
I would say, and the captain will be able to answer this, but I believe last year we did not turn over anyone. I think it's been at least 3 years since we actually turned over anyone. But Captain, are you aware of the last time we actually turned someone over to ICE that had a qualifying offense?
Yes, the last we had one of an individual that was booked in 2019. He was turned over to ICE on January 8th of 2020. And obviously he met the requirements of the qualifying offenses under the government code 6285. So that's the last time we've turned anybody over to ICE. And that was the only one of anybody booked in 2019. We did not turn anybody over that was booked in 2020 or 2021 to ICE.
And if I remember right, the one we did in January of 2020 was pretty egregious, so we didn't want him back. So I appreciate this report and kind of appreciate how you're handling everything.
Yeah, if I could add one more thing, the one that we did turn over in January of 2020 was not turned over on a civil detainer. He actually had a federal judge signed immigration warrant. So we treat those differently. We would honor those at any time because they are considered a federal warrant. He was not turned over just based on an administrative detainer. So I just want to clarify that one point as well.
All right, thank you. Well, we do have a couple hands up in the public, so I think we'll go there now. Our first speaker is the last four digits of 0326. Press *6 to unmute, and you'll have 3 minutes. All right, 03, there you go, welcome.
Hi, this is Charles Wilson. I'm maybe in the wrong area here, but it's hard to navigate your Zoom system because public comments are not at the tail end. And yesterday or the last time, it's 6 hours or so.
Charles, let me help you out. This is about the ICE detainer. I mean,
yeah. So I'll postpone my comments until later. Thank you.
Okay, thanks. It should be short. Hopefully, fairly soon. Thank you. Sorry about that. And we do have 5288. And press *6 to unmute. Welcome.
This is Ken Sawatsky, and I am speaking on the ICE detainer. You know, when this first came forward and they put this on the ballot and everything, I did not see the reason for it other than maybe somebody other than Sheriff Billy was in charge. But under his hand, we can see that this has been not an issue. There's 4 zeros, there's a 614 looking at the schedule here. Which Billy highlighted, which they were. And for those of you out there who, I know it's not necessarily on the agenda, but when things are handled in this kind of manner, it's usually a reason that the person's quite competent, which I feel Sheriff Billy is. And hopefully he's running for sheriff again, and hopefully he'll run unopposed, but that's a whole nother topic not on the agenda. I did have it said on here that detainers received with qualifying offenses, there was one. And I'm having a little hard time with the stats. If they had a qualifying offense and yet they weren't turned over to ICE, I'm not understanding how that would have not transferred there, other than maybe he was one of the number 4 people that were released prior to the detainer being received. But there seemed to be one other person maybe in there somehow. It's a little hard to follow the stats, but I really appreciate how our sheriff has handled this. And I appreciate the board's support in how he has handled this matter. And as you know, I spent a lot of time down in Mexico, just got back last night. And, you know, we have a lot of good people here, and I hope they all feel safe that they're not going to have our sheriff going after them, you know, for these things that really the country has no business enforcing, in my opinion. So thanks again to the sheriff, and maybe just that one question regarding why that one person wasn't actually turned over, because when they had qualifying offenses, it appears. Thank you.
All right, thank you. So we will go back to the board, and Sheriff Hansel, I didn't know if you want to do
I don't know specifically about this case. Captain, do you want to weigh in on specifically about that one?
Certainly. The individual that had previous convictions that would have qualified him posted bail. So as the public may or may not be aware, again, as a civil immigration detainer does not, by statute and by the county ordinance, does not disallow someone from posting bail. So we cannot prevent them from posting bail based on a detainer received. So.
All right, thank you. Supervisor Bohn?
And I wanted to thank Captain Christensen for putting down the descriptions for each one of the items and giving a full description so we know what each one means. And that's why we have agendas, so we can have that. So I appreciate that. It was very, very thorough.
All righty. So beginning of the public, we've heard from our board members, got the presentation.
I make a motion, we accept the report.
All right.
I'll second.
All right, with a motion is second. And I don't see any hands up. So Nikki, can we please have a roll call vote?
Absolutely. Supervisor Madrone.
Yes.
Supervisor Wilson.
Yeah.
Supervisor Bushnell.
Yes.
Supervisor Bass.
Yes.
And Supervisor Bohn.
Yes, please.
Thank you. Motion passes 5-0.
Thank you very much. Have a good day.
Thanks for being here. Thank you both for being here. And so now we will close the public hearing. And I see Jefferson on, but I'm planning to do public comment on non-agenda items. So just in case, I was thinking I might switch it around, but I'm still here. So now's the time we'll take a public comment on non-agenda items. I know we have a few interested people, so if you are, please press *6 to unmute. Well, I mean, press *9 to raise your hand, and then *6. Sorry. We do have like 3 hands up or so. Our first one will be 7094, and if that's you, press *6 to unmute, and you'll have 3 minutes.
Hi, this is Adam, West Coast Populist, calling in from District 4. What I want to talk about today is our biased local media and the way it seems to affect our local politics. Getting involved in local politics over the last 6-8 months with this COVID thing, I've noticed that, obviously the Lost Coast Outhouse and the North Coast Urinal are completely one-sided. They're very far left, woke progressives. And it's interesting that supposedly liberal people that are supposed to be open to the ideas and opinions of others, they basically ban anyone from the comments that disagrees with their political narrative or perspective. So they've done is they've created this echo chamber over there where everybody comments and they read the comments and then they think everyone agrees with them, and no one around here thinks any differently, and they've done a major disservice to our community. And the influence that they appear to have on board members, they tend to go after people quite viciously that disagree with them. Case in point was Thomas Kors, who recently was thinking about running for supervisor and then got, ambushed with this hit piece, and then ended up getting, death threats and all kinds of stuff from local crazy left-wing extremists. This has just created, this is such a disservice. I sent you guys an email about a paper in Denmark that came out and apologized to the readers for their COVID narrative and for not being more skeptical of the government and, not, providing both sides of the issue on COVID. Now seeing that, I was right a whole lot more than twice, as, Supervisor Wilson said. I've been right quite a bit. It's not that I've been right. It's that the sources that I've been accessing have been right. And they definitely weren't the local sources, because they, like the Department of Public Health and a couple of our supervisors, are completely on one side of this issue and won't even look or listen to anything on the other side of the issue, instantly called disinformation. But it's funny that all the disinformation put out by public health over the past 2 years doesn't get addressed. get the vaccine and you won't get COVID. I mean, we were told that how many times? Or, you know, the masks work. We're still trying to say the masks work when the whole world's like, dude, the masks don't work, like all the science. So, yeah, it's just my two cents on this, my perspective on all of this. Thank you for your time.
Great. Thank you, Adam. All right, so 0326, I believe that's Mr. Wilson. We're on general public comment items. And press *6 to unmute.
Hi, this is Charles Wilson. I finally get this public comment area there. I missed that other earlier thing on the clerk of the board meeting on the COVID there. But anyway, at the board meeting on November 16 of last year, the Board of Supervisors Regulation 2210-8 regarding emergency declarations was referred to. At a subsequent meeting, I requested that the board comply with this board regulation. I appreciate the board on January 11, finally, after 2 years of no action, at least from what I can see and everything, I don't see everything that you do, of making an effort, although it's feeble and not even discussed, to review the emergency declaration that is required by the board's own regulation. We've all suffered mentally, physically, and fiscally for the past 2 years of fear and hate of the people splitting everybody apart and everything, the threats and the misguided government regulations. The Omicron mutation may finally bring us out of this media and government-sponsored fear and hate. The CDC is admitting that Omicron is entirely displacing the Delta mutation. Omicron is a highly communicable, and everybody is highly communicable, and everybody will catch it, despite futile efforts to stop it, but it is overall very mild. That's all according to what the government says. We no longer have a pandemic. They haven't agreed to that yet. It has already been a month since the last board effort to comply. I request that the board consult with your legal counsel, that is your high-paid lawyers, on your legal obligation to review the emergency declaration every 2 weeks, not every 2 years. I request that your board include on next week's agenda an item signifying this compliance with your own regulations. I hope that every 2 weeks the board will consider dropping entirely this 2-year emergency. How much of an emergency when it supersedes everything for so many years? Anyway, thank you very much. Bye-bye.
All right, thank you, Mr. Wilson. All right, so we have 0151. Welcome, press *6 to unmute. Welcome.
Hi, I'm finally on the right place, I think. This is Dottie Russell from Southern Humboldt. And one thing to kind of suggest as a way to create a little bit of peace and good productivity with everybody that is calling in and even coming to the meetings would be if you have a time certain for public comment, then people wouldn't be on the phone for 3 hours or 4 hours waiting for public comment at the end, not working very well, in my opinion. I just wanted to applaud you for coming to the aid of the cannabis farmers, because as we all know, that's a significant part of the economy in Humboldt County. And without it, there's really no new direction or help coming along. I wanted to bring up the Avenue of the Giants plan. I don't think there's a plan yet. That's been maybe 20 years. It would be nice to get that going and to work on the infrastructure of the fiber optic line. Right now, the cartel was on the Avenue of the Giants creating very scary drama, and we couldn't get online because there wasn't proper access to the fiber optic. So we're at risk. So it's not just, oh, it'd be fun to play a game. It's
our livelihood and our health and our safety is depending on you activating the fiber optic line to San Francisco. It's right there. We can see it. So we need to be able to use it. That's one thing. The other thing, as far as code enforcement is concerned, there's a lot of drama about code enforcement, but I would have you consider people that have a code issue going on, that are being called, that are part of calling the sheriff constantly. So there's one code enforcement issue that I know of, that you probably know of, that are dealing fentanyl and they're getting by with it. I don't know how that's possible. I can't have a car that doesn't run, and that's a compliance issue, but they can deal fentanyl and have 26-year-olds die. So that is not working. I would say you need to do the twist on code enforcement and get people that have the sheriff called on them for deaths, for all kinds of citations, dealing drugs, having illegal firearms. And is that my time?
No, you've got 20 seconds left.
Okay. So anyway, if you could really put some pressure on with the people that have multiple thefts going on, multiple people that are arrested by going to their house all the time and then finding them in Redway and Garberville and arresting them there. It's just ridiculous. And we as a community deserve to be safe, and we need to rely on all of you to make us safe. Thank you.
Thank you, Dottie. Okay, we've got 5288. Press *6 to unmute. Welcome.
This is Ken Sawalski. I'd like to make public comment on non-agendized items, and my public comment is regarding non-agendized items. So we're going to be double dipping there. Virginia direct communication here. This basically does not work for the public to have this located where you have it at the end of the meeting without a time certain. It's felt to be kind of an affront and an insult to us people out there. Not myself. I mean, I've got very thick skin. I can stay for the meeting and participate. But there's a lot of people that don't. They feel insulted that their time is worth nothing. I mean, if you're at the bottom of the list, the bottom of the thing, and public participation is the least important thing on your agenda, that's definitely sending a message to the public that you don't want to hear from us. And that's wrong, because the only message we can send back is we don't want to reelect you folks. I mean, that's the only message. And so I'm hoping other Board of Supervisors will go ahead and adapt a policy and take this away from the chair. I think the chair should not be changing this. It should be a set policy. And it's been recommended to me by a lot of people that you have 2 time certains. One would be like 9:30 to give you plenty of time to get rid of your first things before that. And then maybe one later in the day if that's so desired. But the new normal is going to be the new normal, and we would like to participate both in person and or through this current format. If you're tired of us speaking and you don't want to be chair, then and don't want to facilitate enablers, I just recommend you just step down and let somebody else be chair. And I also recommend that we have a policy set up for this. It's important enough. The people's participation is important enough to have a set in stone policy that has a little wiggle room, but still we know how we can play. Otherwise, we feel like our time's worthless, and nobody likes to feel that way. So please make that change for us. We tried this, and I don't care what other counties are doing, to minimize public participation. Let's be Humboldt County. Let's be the tip of the spear. Let's do the right thing and fix this problem. Thank you for the opportunity to speak on non-agendized items today.
Great, thank you. And we'll go to Thomas next, 3053.
Good morning, still. Thomas Folder here. First off, I'd like to thank the Board of Supervisors that voted in favor of that tax suspension. That was a lot of time. I think you guys had about almost 10 hours into it between the 2 meetings, and probably another 5 hours of listening to people outside of the meeting. So I think you heard the community and you heard the business community outside of the cannabis industry, and you guys made the appropriate action. So now I'd ask you to move forward with, I think I heard Rex talk about it a little bit, trying to move a state item, because I think that's our next step. And then also I'd like to see an agenda item where you guys are talking about making recommendations to the state of California as far as their metric requirements, all these different things that contribute to cost of goods produced costing more money when it's really just worthless data, wet harvest weights, all those different types of things that go to cost of goods, and just continue working together with the community. I think it's important that the non-cannabis industry and the cannabis industry and county officials work together to figure out a good long-term sustainable plan for all the multiple industries within our county. Thank you for the opportunity to speak.
All right, thank you, Thomas. And then we'll go back to the board. What I would just remind people is everybody gets to make public comment on every one of our agenda items, potentially, as it is. And so I think we do offer ample opportunity for public comment. We've got 57 or so yesterday. So at this point, I think we will move on to closed session. And County Council Billingsley.
Thank you, Chair.
Hold on. Actually, Supervisor Madrone, we're going to come back. It's going to be a short closed session. Or do you want to mention Mr. O'Hara now?
Yeah, normally we do them now because there's nobody here when we come back from closed session.
Sometimes we spend hours in closed session. That might be why, but okay, yeah, please do.
Thank you, Madam Chair. Yeah, today we're closing the meeting in honor of Joe O'Hara passing from out in Willow Creek. Joe was a member of the Fire Safe Council from 2007 through 2010, and also from 2016 to 2021. And at a recent meeting, he was fondly remembered for his dedication to public service and constant good spirit. He was the leprechaun at the Irish festival out there. He assisted Willow Creek in becoming a Firewise community and was a fixture at many events. And at the time of his passing, he was also serving on the Willow Creek CSD and was president of the Willow Creek Fire Safe Council, having been a longtime member. Those who knew Joe will very much miss him. So just wanted to close this meeting in honor of Joe O'Hara. Thank you.
Thank you, Supervisor Madrone. So we'll come back and do that. And County Council Billingsley, would you like to let us know about closed session?
Yes, thank you, Chair. It's the intention of the board pursuant to Government Code 54957.6 to meet in closed session to review the county's position and instruct its designated labor negotiators, Alicia Hayes and Jack Hughes, from the various groups listed in the agenda item M1.
All right, and we do have public comment on this one, and we'll go to 5288. You have your 3 minutes to comment on this item.
I do recognize that I can comment on every single item. In fact, I have today, and I shall probably continue to do so. I'm willing to cut that back to just about nothing as long as we have time certain, but that's just an offer. I recommend that other people do engage in civil disobedience. But anyway, I did wish to comment on your closed session. Earlier in the day, the auditor controller brought up a very relevant item. And I think maybe when you're negotiating with these people, you should do the right thing and you should offer to reimburse them for their costs, whether they're working at home voluntarily for reasonable costs, voluntarily or not. So hopefully you'll reach out to the union. Hopefully the union's listening to this before they go into session. Maybe they're not directly participating with you. You're just talking to your representatives. But why don't you ask your representatives if you think that's a pertinent issue that people should in this day and age, the new normal is the new normal, and people will be participating in for home. I had a person who was a county employee who was running from me. The particular facility they had did not have internet to it. They did not have their own. And so they were not able to participate. And your internet service, from my input that I've had from some of you folks and from other things, is not reliable. It goes down on a whole day basis for people who need to work, and they need to be able to do this at home. I would not offer them to have an on-site thing where they could come and work there, because the internet you have there isn't working also. So you do need to come up with technology. I think there should be a fantastic negotiation and bargaining point during your discussion with your unions. And I think your employees, I can't speak for them, but I would hope they would be appreciative of not having to have out-of-pocket costs. You folks get reimbursed for just about anything you want to be reimbursed for, is my perception of what happens there, including travel and other needed things. Your employees should be on the same basis. So I don't see any negotiation here as far as how much you're going to increase your own pay. That's not part of this negotiation. So hopefully that will be happening in the public forum sometime. The public will be very interested to see how that's going to transpire. Thank you for my opportunity to talk on your closed session items. And I thank you for Steve Madrone for memorializing this fantastic individual in the Willow Creek area. He's made a major difference up there.
Great. Okay, thank you. So with that, we'll adjourn to closed session, and when we should come back fairly quickly. Is that correct? Okay. I'm always afraid to make a stab at that, but all right. So we believe we'll be back quickly. Sorry, can't be more precise. All right. We have 3.
Got 4.
Yeah, we do. All right. Maybe I have a report out of a closed session.
Yes, Chair. On item M1, there's no reportable action.
All right, thank you. And as a reminder, today we are adjourning in the memory of Joe O'Hara. And with that, we are adjourned.